Hello friends, I have been asked to make this short video to discuss female intimate hygiene. My friends who run the Oche Kitchen Forum have given me this opportunity to speak to women about this topic that is very important to us all. So first, introductions. My name is Uloma. I am an obstetrician gynecologist in the UK. I believe in the States you refer to us as OBGYNs. So that's me. So first of all, before I delve into the details, I think we should have an understanding of what we're dealing with. So the very basic anatomy of the female intimate area. Let's just break it down into external and internal. So the external portion is the mons pubis, the labia majora, and the labia minora. So this refers to the hairy portion, that's the mons pubis, at the top of the pubic bone in the front. And then the lips are the labia majora, where you've got the hairy area, and the labia minora, the inner lips, which haven't got any hairs. Then the vagina is more internal. So what is normal for female anatomy and female physiology, the way things function normally? The external portion that has hair also has oil and sweat glands, and these, it's normal for women to sweat a little bit in that area. It is normal to release what we call sebum. It's sort of an oily substance that is normally released as we reach puberty and as we get older. And also internally, the vagina is designed or created with glands that release fluids that are necessary for normal sexual function. Now, just to point out and clarify, it is normal for the vaginal area to have a smell that is fairly neutral. It shouldn't be nasty. It shouldn't be unpleasant. It shouldn't have a strange color. Normal vaginal discharge is anything, you can describe it as anything from a clear discharge to a slightly white or slightly yellow, very light yellow. As long as it doesn't stink badly, as long as it doesn't itch, and as long as it's not copious a lot, that is normal. And in my profession, I meet a lot of women who worry about the way they smell. Please take note that a certain smell is normal for that area. If it is not pungent and horrible, mainly fishy smelling, then it is nothing to worry about. So talking more about the vagina and how to recognize when things have gone wrong, it's important to understand how the vagina functions normally. So there's a normal pH balance. Simply put, the vagina is acidic. pH refers to whether something is more acidic or more alkaline. So the vagina is designed to be acidic in nature, the environment within the vagina. Also, the vagina, in the vagina, there is a delicate balance of microorganisms or bacteria or bugs. I put it simply to my patients as an environment where there's a balance between the good and the bad bacteria. When there is anything that disrupts this balance, then you could get symptoms such as a bad smell, an itchy discharge, or a discharge that is a lot copious in nature. So what are the things that can cause this imbalance within the vagina? One of those things, number one, sexually transmitted infections. So as women, it is important to practice safe sex. Now this would be topic for another discussion altogether, so I won't go much into that. Number two, what else disrupts the normal vaginal environment? It's washing with soapy stuff. Highly perfumed washes, soaps. There are lots of products that promise you wonderful results, but if you look at the list of ingredients contained within that, it's no surprise, it's no wonder that when we wash with these things, we get an unpleasant discharge. So, in order not to disrupt the natural balance within the vagina, we need to avoid highly perfumed soapy substances. So what should you wash the vagina with? Plain water, plain clean water. Now, in reference to the external bit where there are the hairs and the oil glands and the sweat glands, yes, of course, you can wash the external bit with soap and rinse off. So please bear that in mind. Third thing that can disrupt the normal vaginal environment is antibiotics. When you're ill and you take a strong dose of antibiotics, maybe for a chest infection or urine infection, it can disrupt that balance between good and bad bacteria, meaning that the bad bacteria will then thrive and cause you symptoms such as a smelly discharge or mainly thrush. Antibiotics will usually cause thrush. It's actually a fungal infection to correct things. So these are the things to bear in mind. Another one that isn't very common in adults, in younger girls, when you have bits of tissue paper stuck in the wrong place and you don't rinse that out properly, as a foreign body, it can cause the bad bacteria to multiply and cause a smelly discharge. So it's important to teach our younger girls, our teenagers, the importance of hygiene, to rinse the area properly when we have a wash. So what do you do when you notice that your vaginal discharge has changed? First of all, what is the color? What is the smell? Usually a fishy discharge that is copious and greeny is referred to as something called bacterial vaginosis. And if you haven't had unprotected sex, it's very likely that this is what it is. So see your doctor, and usually a course of antibiotics will clear that. In the same vein, if you have a discharge that is itchy, smelly, and you've had unprotected sexual intercourse, it's important to see your doctor to be tested for a sexually transmitted infection. So other general measures to make sure that we keep the vaginal area clean is things like trimming. A lot of hair in that area can attract a lot of sweat, and bacteria, discharge, sweat, oil can all mix up and cause an unpleasant smell. So it's a good idea to trim the hairs. If you shave with a razor, you're likely to increase your chances of getting painful ingrown hair. So just trimming the area, washing the hairy area with a gentle soap, making sure that you dry properly. And another tip, which we may not like, is wearing breathable cotton underwear. So I know that thongs are fashionable and sexy, etc., but wearing those all the time can encourage the bacteria from the back passage to come into the vagina and cause an infection. Therefore, best to wear boring white cotton as frequently as possible. Okay, so remember, trim the hair, wash the hairy bit with soap, wash the internal bit with water only, rinse, rinse, rinse. Practice safe sex. Wear boring white underwear. White usually. Why do I say white? Because sometimes the dye in underwear can cause us to react. I'm not saying that it happens with everyone, but it's something to bear in mind as well. Okay? So it's simple, straightforward. Ladies, it's been a pleasure talking to you. Drop your questions and comments, and hopefully I'll see you again soon. And thank you to the Oche Kitchen group for giving me this opportunity.